So let's talk about those little bumps that can sometimes pop up under our eyes. I know finding a new one can be a little alarming, right? But the good news is we're about to clear up all the confusion.
You've probably had that moment. You're just looking in the mirror and bam, there it is, a tiny new bump. And your mind immediately starts racing. What is this? Is it serious?
Well, let me just start by saying, take a deep breath. You are definitely not alone in this. And the best news, right up front, is that almost all of these little bumps are completely harmless and usually pretty simple to manage. Okay, so here's our game plan for today. First, we're going to figure out what these bumps actually are. Then we'll dive into why they happen in the first place. After that, we'll build a solid treatment plan, and we'll wrap up with what I think is the most important part, prevention. All right, first up, let's identify these things. Because honestly, knowing what you're actually looking at is the absolute most critical first step. It changes everything. Let's start with the usual suspect, Milia. These are those teeny tiny, firm, pearl-like cysts. They happen when keratin, that's the same protein that makes up your hair and nails, gets trapped under the skin. Think of it like a tiny traffic jam in your skin's natural shedding process. And I gotta stress this, they're not a type of acne. Okay, this chart is super helpful for telling the big three apart at a glance. You see the major differences, right? Milia, like we just said, are painless and caused by trapped keratin. A stye, on the other hand, is an actual bacterial infection. That's why it's red, swollen, and hurts. Then you've got a chalazion, which is from a blocked oil gland. It's usually painless unless it gets infected. So you can see three really different causes. Now, beyond those main three, there are a few other things it could be. They're less common, but the one to really pay attention to here is xanthelasma. If you see these yellowish patches, it might actually be a sign of high cholesterol. So that's definitely something you'd want to chat with your doctor about. So we've nailed down the what. Now, let's get into the why. Because if you can understand the root cause, you're already halfway to preventing it from happening again. You can really see it broken down here into three main pathways. You've got keratin building up, which gives you milia. You've got bacteria causing an infection, which leads to styes. And you've got glands getting clogged up, which results in chalazia. It's really that simple. When we look at what puts us at risk, especially for things like styes, one factor really stands out, and it's something every single one of us has complete control over, our daily hygiene habits. So what does that actually mean in the real world? Well, it's the simple stuff, touching your eyes when your hands aren't clean, using makeup that's way past its prime, or not getting it all off before you crash for the night. Each one of those little habits can create the perfect environment for a bump to form. And it's also worth knowing that sometimes it's connected to your overall health. If you have chronic inflammatory conditions like blepharitis or rosacea, you might just be more prone to these. The same goes for conditions that impact your immune system like diabetes. All right, we have covered the what and the why. Now let's switch gears and talk about the action plan. What can you safely do at home? And just as importantly, when is it time to call in a professional? For taking care of things at home, especially for styes and chalazion, your absolute best friend is a simple warm compress. Seriously, this one little tool can make a world of difference in helping them heal. But you've got to do it right. Use a clean washcloth and warm water, not hot. Gently hold it over the area for about 10 or 15 minutes. Try to do this a few times a day. And here's the golden rule. Use a fresh, clean cloth every single time. You don't want to put any bacteria right back where you're trying to get rid of it. Okay, now for Milia. This is probably the single most important piece of advice I can give you. Please, please, please do not try to squeeze or pop them yourself. A milium isn't like a pimple. It has no opening to the surface. Trying to force it out is a recipe for scarring and infection. Just don't do it. This is a job for a dermatologist. Which brings us to a really important question. While most of these bumps are no big deal, there are some definite signs that mean it's time to stop the home care and get a professional opinion. So here are the red flags to watch for. Any change in your vision, severe pain that isn't getting better, a bump that's growing really fast, or one that's just sticking around for weeks and weeks. All of these are clear signals that it's time to see a doctor. All right, we've gone through identification and treatment. Let's wrap up with the most powerful part of all, how to keep these things from showing up in the first place. It really boils down to some simple do's and don'ts. On the do side, wash your hands and always, always take your makeup off before bed. On the don't side, stop sharing makeup and please go through your makeup bag and toss anything that's expired. These are such small habits, but they make a huge difference. And the products you use matter too. When you're shopping, look for the word non-comedogenic. That's just a fancy way of saying it won't clog your pores. And for anything you use near your eyes, seeing ophthalmologist tested on the bottle is always a great sign. So, after all of that, if there's just one thing you remember, let it be this. The vast, vast majority of these little bumps are harmless and totally manageable. So let's run through that final checklist one more time. 1. Identify what you're looking at. 2. Treat it the right way. Warm compresses for some, but hands off the Milia. 3. Focus on prevention with great hygiene. And 4. Always monitor for those red flags we talked about.
And that brings us to the final thought I want to leave you with. After listening to all of this, what's one small, simple change you can make to your routine starting today to help out your long-term eye health? Maybe it's just being more mindful about washing your hands. Something to think about.